the NIH expects, and this is the main point, that sex is a biological variable will be factored into research designs, analyses, and reporting in vertebrate, animal, and human studies. And it doesn't say cell lines here, but I think it's something that probably you would be advised to discuss if you do work in cell lines, particularly based on the data that I showed you earlier, that there's definitely interaction of chromosomal sex with a variety of outcomes. So I think a main factor here, okay, you have vertebrate animals or humans. If you don't have to worry about this. Is your study designed to look at sex differences? So let's say you're not doing a study that's interested in sex differences. Take the easy. What you need to do is then ask the question, are you including both sexes? And then we really get into, and we were talking earlier about, do you have a disease that's a sex-specific disease or a sex-preponderant disease? So sex-specific disease would be polycystic ovary syndrome, which I study, or postpartum depression, though I guess husbands, that might be a very interesting study, is to study the partners. But I think there it's straightforward to provide the explanation that this is a sex-specific disorder and therefore, based on the biology, I can't do it. I would say probably, though you would need a literature, let's say you get into disorders that aren't sex-specific, but sex-preponderant. So rheumatoid arthritis or some autoimmune disorder. Then I think you need to marshal the scientific literature to say that the presentation in a male is going to be different, or there's literature that the male responses to this are distinct. Therefore, and depending on how big, how much money you have in your budget, I can tell you what I usually do, and this comes up for me more in the ethnicity arena than in diseases, but my studies are usually of insulin action and diabetes risk, and there are big racial and ethnic differences in that. And it has been acceptable to study sections to date for me to say, here is the literature on these racial differences in insulin sensitivity. Therefore, I can't mix different races and ethnicity. I have to study them separately. What I'm going to do is, as a first approach, ask the question in this racial ethnic group for whatever reason. And then once I have the answer there, in future studies, I'm going to expand that. And that usually has been good enough for many years, because the race ethnicity inclusion has been going on for probably 15 years now. But you can't say it's just because it's convenient, or I live in Rochester, Minnesota, and there are no Samoans. Those don't go over well. It has to be a scientific reason, not an access reason. And it's not supposed to be a financial reason either. So you can't say, what are you kidding me? This grant only gives me $500,000 a year. How am I going to do this? You have to avoid those explanations, though they may indeed be true. what I have seen, at least in the study section I'm on, which is keynote, which is kidney, diabetes, obesity, and nutrition, integrative physiology, and genetics. People have been saying they're going to include both sexes, and they are going to adjust in their analyses for sex. I consider that scientifically inadequate myself, but I think that is still being accepted by the study sections. These things are very study section specific. And it's sort of the culture of the study section, and it may even be who's on the study section. You could have one person speak up and say, that's really not adequate scientifically. So I'm not advising people to do that, but that is the most common response that I'm seeing when people are discussing how they're going to address sex as a biologic variable. I think, and from the data I showed you earlier today, there can be really major sex differences. And it behooves you, if you are going to include both sexes, to have data to show that there isn't a sex difference and be able to cite that as preliminary data. And if there is a sex difference, I think you really have to power, and you want to include both sexes, you're going to have to power your study to look at that. And any of you, all of you who are scientists know what that does to sample size to really ask that adequately. So I think de facto, to do this well, does markedly increase the complexity and the budget of studies, and I think that's why people are just sort of pretending that it's okay to do the adjustment. And really, if you look at the history of inclusion of women, it was in the GAO report that women were markedly underrepresented in clinical trials was in the early 90s. And many, many, many subsequent trials have just done okay, we'll include women as we can enroll them without any efforts to make it equal, and adjusted for it. And we really have very inadequate information on sex differences from that approach. So that it's just not an acceptable approach, but I think this regulation came out when the NIH budget was flat and they were reducing grants, and they certainly weren't awarding enough money to, adequately power your studies to answer that. So what about animal studies? A little known fact in diabetes research is that only the males get diabetes in almost all of these animal models of diabetes. And that if you do the manipulation or do these different genetic knockouts, the protection of female sex, which is both estrogen and chromosomal sex, is so powerful that they won't even manifest the disease. Now, since I am not on a study section that sees many mouse model grants, I don't know how this is being interpreted. I haven't heard a lot of screaming and yelling from the diabetes community, so I believe probably the explanation that only the males get the phenotype has been acceptable. But in a sense, I mean, that begs the question of what's going on, and it's a really very important scientific question, and I just happen to know the diabetes field. I'm sure it's true in many, many more disease models that there are major sex differences in which sex gets the disease, and those really should be studied. But I tend to suspect that the explanation that only the males manifest the phenotype is still being adequate. So let's say your answer is yes, and you really do want to look at sex differences. Then you have to do a complete power analysis and sample size to have the power to look at the impact of sex across whatever your study endpoints are, at least your primary endpoint. So you're doubling, you're adding a factor of 2 to whatever you're doing. So however you have your analysis, you're just adding groups, which means you have to have more rigorous p-values, for every group, a Bonferroni correction. That means your p-value has to be divided by the number of tests. So the more tests you do, the more rigorous your p-value has to be for statistical significance. So it really has a major effect on your sample size calculations, and you're going to have to select pretty, questions that people really feel are important to be answered to, kind of make the threshold for having a highly impactful, significant project that study sections are going to want to fund. So I think that can be a very, high bar. There is now some very elegant, and I think if you're going to do it, you have to do it at a very high, rigorous scientific level. So I showed one slide earlier today. Again, it was mouse models, and it was looking at the interaction of genetic sex and hormonal sex on metabolic outcomes. So you have to be able to work with these probably different mouse models that are where you can vary both the chromosomal sex and the hormonal sex. So you can get XY hormonal females, XX hormonal males, and different mixes of animals that are lacking estrogen receptors, lacking androgen receptors. So you have all these now knockout models where you can very elegantly do this. And there are some exceptionally sophisticated studies going on now utilizing mouse models of hormonal and chromosomal manipulation to start to understand these interactions. So I think it's a high bar and has to be done. So you're really getting answers that are scientifically rigorous. So I think these studies are going to be hard to do in humans because it's just difficult to have that level of rigor in your analysis. I think overall the advice, NIH funding continues the pay lines to be around 10th, 12th percentile. So it's very, very difficult to get funded. So I think that being cautious and rigorous and answering questions in the most rigorous, reproducible way is the best way to go. And so a lot of the sex differences are of interest, but it may just be a weakness in your grant if you can't do it. So I think thinking of designs where you keep your study design simple and, you either stick to a sex-specific disorder or have extensive data that there isn't a sex difference and that you can pool men and women is a kind of a conservative piece of advice, because you can just get really get your grant savaged if you're not doing this very, very well. Yep.
Does this consideration go into the impact score, or how, or is it just more like a yes, you passed this or you didn't?
It's supposed to go. This is part of the scientific. So let's see. So it's part of the approach, which is part of the impact. So you've got your overall impact, and then it's made up of the significance of the application, who the investigators are, innovation, approach, and the investigators present adequate plans to address relevant biologic variables, such as sex. Now, since this presentation was prepared as of the February 5th grant submission this year, there are new relevant biologic variables. Age, health status. So you have to justify why you're not studying old people or young people. We've had the children for quite a while, but now you have to justify why you are and aren't including different age ranges. You have to justify the health traits that you're selecting on, why you're studying only healthy people or not healthy people. So it's sort of diluted the sex as a biologic variable by saying there are a number of biologic variables that you have to comment on in your study design. So life just keeps getting more difficult. And this is a little note to the reviewers here. For single-sex studies, you should consider whether the scientific justification is convincing to you. So.
Because I have just sent in an R1, but it's GCO, so not yet that, so I could get it back, because it's totally during pregnancy, but I did not write somewhere there like this is a sex-specific study.
Well, what did you write in the section where you had to just, did you have a section as sex as a biologic variable?
No, I don't think so.
Okay. So one general piece of recommendation for grant writing, I've been like on multiple study section chair, is to title your section or to have a section that specifically has the name of something they're telling you to do. So I have a section called Impact. They tell you to have a section called Innovation, but I have also a section called Impact. I have sections labeled Scientific Premise. I have sections labeled Scientific Rigor.
Yeah, I've got all these
Yeah.
except for the sex as biological variables.
So if you have a nice reviewer who likes your grant, they will say, of course, this is a sex-specific disorder, and they will be nice to you. If you have somebody who doesn't like your grant and wants to criticize you, they will say, as a criticism, you didn't address that, even though it's obvious.
Oh, so I should get it back and I add 2 lines somewhere?
Well, you may want to I would take the risk and hope that they like your grant and you're going to get a good reviewer and it's pregnancy, so it's so obvious. But you really should address all these things specifically, because nobody can criticize you if it's there and it's labeled. If it's implicit rather than explicit.
Yeah, but it feels really stupid to say for pregnancy.
But you should still.
Why it does not happen in men.
So I actually got a call from NIH a number of years ago from somebody who was going over my inclusion enrollment reports in some basement someplace. And they said, why aren't there any men here? And I said, well, polycystic ovaries don't happen in men. But I don't know. This person was somebody who didn't know science,
Or has very
Yeah, and
mentally disabled.
but you never assume anything.
I did work in cervical cancer, which
Mm.
is yeah. But if your inclusion criteria, pregnant women,
Yeah.
with, I think that maybe you can speak to that. I mean, if you're clear in your inclusion exclusion, do you think that you
I think you still need to have your little one sentence. I just think you need to play it safe
Yeah, no, I will. I will just add the sentence.
with all of these things. I mean, it does get pretty ridiculous,
Yeah, it get, yeah.
but I just think you're safer doing it that way.
No, I really.
Because the sex is a biological variable, comes up now all the time in review. In fact, it's called out at the end of all the reviewer, each, that you give your overall scores, and so people sort of see where the range of scores is. Then the reviewer number one kind of gives their critique. The other reviewers do something, add. And then the chairs now, the study section chair who manages the review, will ask, what about sex as a biologic variable? Was that addressed?
are they now asking that for age and for all those other ones?
So I haven't been on study. The first grants with that as a rule won't be going to study section until June because this just got implemented. But I'm sure they will, because as the chair you have this very specific list of things you're supposed to ask, like, is the budget appropriate? Is this? But this is and you have items that are score determining, and then items that are just administrative. So hazardous materials, which now it's expanded. Is it hurting the environment? I mean, it's really crazy, and increasingly crazy. But they're ones that you talk about after you've scored the grant, but other ones like this one you talk about as part of scoring the grant, as part of the scientific scoring. And this is it comes under rigor and the rigor and reproducibility initiative. So I think everybody has to comment on it if your study includes anything that has X and Y chromosomes. I think even worms and flies. I'm trying to think if there's some sort of organism you could study that doesn't have a sex. You would want to say that because the reviewer may not know. I would also, if you're using cell lines, comment on it. Though it may not be known, but let's say you're establishing primary cell lines, I would probably say something about it, who they're coming from. Then, I think if it comes from a human subject, if you can talk about sex as biologic variable, you get into race, ethnicity, and your options are they're de-identified, so I don't know, and you might also be able to, on cell lines, be able to say they're de-identified, but somebody might want to ask you to then, test it. If you're working in tissue resources, you probably do want to try to know what the race, ethnicity, I've seen that, required or discussed in studies where endometrial tissue or fibroids have been used that, they want to see in the enrollment forms, even though it's coming from a tissue bank, and unless you can really make a compelling argument that there's no way you can find out, but you would have to write there's no way I can find out where these, what the race, ethnicity was of the donors of these tissues, because I've certainly seen an expectation that you would have an enrollment, inclusion enrollment form for tissue. I think just kind of having a worst case expectation for how fussy the study section is going to be is usually a pretty good way to deal with things. Because some people can just get very, very obsessive about these regulations. Right. Well, some people try to get around it by doing it in the human subject section. And there you just have to be careful because you're not supposed to put anything that's necessary for the scientific review, or the reviewer isn't supposed to consider anything outside the research plan as going to the scientific design. So I've seen people put power analyses in their human subjects, and you can't count that. So you have to say that the power analysis is missing. Some you certainly get, as with anything, the range of reviewers, and some people are very sympathetic and will really give people the benefit of the doubt and will say, well, it's clear from the human subject section that this, that, and that are true. And it just depends on, kind of the mood of the study section and the overall quality of the grant, and the level of enthusiasm for the grant. I think people do try to, get grants they like, be less critical of other things like this. On the other hand, if people are looking for things to criticize, these are very easy things to criticize, that can take a score down, And there's also tremendous, tremendous pressure on the reviewers now to spread out the scores. So, to really have grants. So only half of the grants, approximately, that go to the study section are discussed. So they take the preliminary scores, take the top half. So you would say, oh, well, then that means that the grants that are discussed can only have scores of 1 to 3 because they were in the top half. You score from 1 to 9, and you're taking off the best ones. But no, then you're supposed to take those that were in the top half and spread them out again. So you can have situations where somebody has a grant that wasn't discussed that got a better priority score than a grant that was discussed, because upon discussion people decided, oh, well, this is horrible, awful, I'm giving it an 8. But the mandate to spread scores is, they can't make you do it, but they're very, very insistent, and the study section chairs are very insistent that you try to spread the scores out. So the really good grants, rank very, very well, and there isn't, and it's good ultimately for the scientific community, because if you don't spread the scores out, then it's administrators who are deciding who gets funded rather than the scientific merit if all the scores are all the same, which certainly happens because people want to see grants get funded. So everything they like, they give a 2, and everything, and so you get a whole bunch of grants with scores of 2, and then how do you know which of that pack, should get funded or not? So I do agree with trying to spread the scores out. But it's just, it's in errors when the pay lines, when there isn't so much money, I think it really perverts the review process. If people have any questions about this, or well, hope so. It's a little depressing, but
I
yeah.
missed the thing about, so you mentioned the thing about age. Talk a bit more about that, the new PCIU.
So they now have, as of grants that went in after, I think it's January 25th, that, let me see if I can find the guidance here specifically.
Would that mean that
You have to be very, I mean, that's something to think about and discuss. And I just sent in a grant, went in last week, so that's how I'm all up on. So every time now, you know, that I'm getting ready to do a grant, because they, the rules have been changing so frequently, is we all go in and check the rule updates. Okay, so they updated the rules December 7th. And January 25th was the implementation date, but let's, okay. Usually the study sections, thankfully, are a little bit behind too. And so, unless it's something the NIH really wants to highlight, like the sex is a biologic variable, or they were, I don't know right now, but rigor and transparency were very big for a while.
And when they're trying to spread the scores out.
Spread the scores.
Something that would be able to really make something go with
Yeah. So you can see that, or on scores that are coming back over the past year or so, that the verbal descriptors will be very good and the score will be, you know, 4 something. And that used to be like, you know, you'd shoot yourself. And now that's, in fact, they say an average grant should be a 5. And so above average, 5, 1 to 5 and below, and that you really should be using 6s and 7s. You know, people used to try to be, you know, sensitive and not give people terrible scores, and they're really trying now to get, you know, you to really use the lower range. So anyway, it would be, I think, it would really be nice if there were some central people here that were really up on the rule changes. I get the feeling when I've gotten in like this most recent time, that even the people in grants and contracts weren't, you know, completely familiar on how to address some of this newer stuff. So it does make it really difficult.